Hey there, it's Madison Burgess. Welcome and thank you for taking the time to learn a simple technique called the core release massage that will take only a few minutes a day and will help you with relieving constipation, have better poopies. Yes, we all could be pooping more. I know, I like to talk about poopies. Nobody does, but pooping 3 times a day is really important. Even if I can get you pooping once a day, I'd be happy. I'm sure you'd be happy too. Improve digestion, reduce bloating and inflammation, decrease waist size, a flatter tummy, who wouldn't like that, and support and protect your pelvic floor. Did you know that 1 out of 3 women have some form of pelvic floor dysfunction? And did you also know that poor digestion, constipation, inflammation are only a few reasons why women are experiencing pelvic prolapses? So this technique I'm about to teach you, I will be demonstrating very soon, will support and protect your pelvic floor. In this video, I will be demonstrating the core release massage technique. Please, whatever you do, don't jump ahead. I know it's tempting. I do this all the time and I miss out on some very important information. And then I have to go back and start all over again. Before we dive into the how-to, there are a few things that are key to know and understand. If you are pregnant, you will not be able to do this technique. So please don't attempt this technique. There are other programs that you can do to get the same great results. So the technique I'm going to teach you will release and relax muscle and organ tension, increase blood flow, decrease pressure, remove inflammation in 3 core areas: the thoracic, abdominal, and pelvic floor. It's an effective way to reduce problematic pressure that can result from pregnancy, childbirth, chronic constipation, incontinence, digestive disorders, intense exercise, and everyday stress. Because this is an easy technique, don't underestimate what it can do for your health. So let's get started. What will you need? You will need organic olive oil or jojoba oil. It's a personal preference. They both work. Organic lavender essential oil. I love putting a few drops into the jojoba oil or olive oil because it relaxes the senses, releases nervous tension, and enhances blood circulation. You'll also need a small amber or blue glass bottle. You can get this at Mom's Organic Market or even Whole Foods or your local organic grocery store. Also have a white hand towel or paper towels ready to be able to wipe off any excess oil when you're complete, or even sometimes when you're beginning, because you may put on a little too much in the beginning. Now, the best time to do the CRM, the core release massage, is at bedtime. And the reason why I say this is because everyone goes to bed, so no excuses. It's a great way to end your day, release the tension of the day, and sleep more soundly. Trust me, you will sleep more soundly. So let's go to the massage table so I can demonstrate how to do the core release massage. Okay, let's get started. We're here at the massage table, but just so you know, you don't need a massage table to do this effectively. All you need is a bed. And as I recommended, to do this at bedtime, because we all go to bed, so no excuses. This technique really works when done right. Also, I want you to know that it's going to take me longer to show you the technique than it is for you to actually do it. Okay? So let's go. There is a product called Renew 28, and I'm going to just, so you can see it. And I like using this product because it helps aid in the digestive process, and also it helps break up scar tissue, and it penetrates deep into the body, and it will help with increasing circulation and blood flow. So when you increase circulation, you're increasing blood flow. And when you increase blood flow, you're getting rid of inflammation. And that's what's causing all of the pressure in your digestive system. So all I do is take this product, Renew 28, I tap it because it is in gel form, and I only squeeze a little bit out. Very, very, very little. Maybe you can't even see that, but it's about, a dime size worth. And then I put it on the belly. You don't need a lot. It goes to work right away. And then I just give it a minute, maybe 30 seconds or 60 seconds to dry, because I want it to penetrate into the body without the oil interfering with it. After about 60 seconds, you're going to apply the oil, which is either olive oil or jojoba oil, they both work, and add a little bit of lavender essential oil to the oil and just mix it up. But you're only going to put about 2 to 3 drops, maybe 4 drops. You don't need a lot of essential oil. And as I recommended, please get organic products, because anything you put on your skin penetrates into the body. So whatever you put on your skin can either insult or complement your health, okay? So we just take a little bit, not much, maybe a nickel's worth. Rub your hands together and then apply it to the belly. Okay, now I'm applying all the way up to the bottom of the ribs and all the way to the top of the pubis bone, okay? And a little bit on the sides. Now remember to have a white towel or paper towels to wipe off any excess oil, just in case you put a little too much on, because sometimes that happens, especially in the beginning. You're kind of figuring out how much your body really needs. Okay, so what I want you to do is use the pads of your fingers, okay? And you're going to take the pads of your fingers and you're going to put them, this is the first section that we're working on, which is the pelvic floor. And you're going to take the pads of your fingers and put it right on the edge of the pubis bone, at the top of the pubis bone. And you're going to drop down, just drop down. You see my hands dropping a little bit? And you're going to scoop up towards the belly button, but just about 2 inches. You don't need to go all the way up towards the belly button. As a matter of fact, you probably just go about halfway. So at the top of the pubis bone to the belly button, you go about halfway. So you're going to do that again. The pads of the fingers go on top of the edge of the pubis bone, drop down and scoop up. Now when you're doing this, you want to go as deep as you can and as deep as it is comfortable. And you drop down and you scoop up. So you do that 3 times. And then what you're going to do is go over to the inguinal ligament. And the inguinal ligament is between the hip bone, the top of the hip bone, and the edge of the pubis bone. And it feels like a guitar string. And you're going to be on the edge of that, and you're going to scoop. You're going to drop down, and then you're going to scoop towards the center in a diagonal movement towards the belly button. You do it again, and you drop down, and you scoop up towards the belly button. And you do it again, one more time. Perfect. Now you're going to go to the left side and do the same thing. The pads of the fingers are on top of the inguinal ligament, and you're going to drop down and scoop in a diagonal movement towards the belly button. And do that 2 more times. Drop down and scoop up. And please go as deep as you can. Okay, so now we're going to go back and do that 2 more times, all right? So on top of the edge, our pads of the fingers are on the top of the edge of the pubis bone, and we're going to drop down and scoop up. Drop down and scoop up. Do it again. Now over to the right side of the inguinal ligament. Our pads of the fingers are on top of the inguinal ligament, and we're scooping up towards the belly button in a diagonal movement. You're going to drop down and scoop up, drop down and scoop up, drop down and scoop up. Okay, so on this person, I feel a little bit of tension here, and when you feel some tension or maybe a trigger point meaning you feel a little bit of pain, spend a little bit more time in that area. And there's no wrong way to do this. You're not going to hurt yourself. And you spend a little bit more time in that area, going deep into that. And sometimes what you want to do is just sit on it with your fingers and go deep into it and just allow it to move. And you probably will feel it moving. So do you see what I'm doing? So it's starting to release. So I'm going to go on to the next section. So we just got done doing the pelvic floor. And now I'm going to do the abdominal section. And the last section will be the thoracic. All right? So you have your belly button here. Yeah? And what we're going to do is just take one pad of the finger, and we're going to move in circular motions, and we're going to go clockwise. So I'm going to do circular motions. I'm going to be really close to the belly button, but not on top of it, and going in circular motions. Right now, I'm working the small intestines, and I'm encouraging it, one, to release tension, increase blood flow, and also to tell the small intestines that it can move the poopies. Yes, we talk about poopies. It can start moving the poopies out. We all have fecal matter stuck to the inside of our small intestines and large intestines. And by doing this technique, it's going to help release that fecal matter that's stuck inside the small intestines and the large intestines. Okay, so you want to do it, you want to do this motion about 6 times. You can do it more if you want. Now, right here on this person, I feel some tension. So I'm just going to sit on it. So if you feel tension or a trigger point anywhere in the pelvic floor, the abdominal floor, or the thoracic cavity, you want to spend a little extra time in those areas. Now, it may not completely release on the first time you do it, but if you're doing this consistently, and consistently means, this is what I would suggest, is to do it every night at bedtime for the first 20 to 30 days. And then after that, you can start doing it, 3 or 4 times a week. And this doesn't take long to do. It's about 5 minutes. Okay. So that's releasing. That feels much better in there. So now I'm going to take the pads of my fingers and I'm going to go in circular motions. And when you drop a pebble into water and how it ripples out? Well, this is how you move around the small intestines, is you start very close to the belly button and you start to move out in circular motions, and your circular motions get bigger and bigger. See how they're getting bigger and bigger? Okay. And then I'm going to lift my hand and come back close to the belly button and do that same circular motion, going clockwise and making those circles bigger and bigger. Okay, so I'm going to do this 3 times. Now, about right here is where I'm feeling some more tension. So I'm going to just spend a little bit more time here. Oh, and they kind of jiggled a little bit on me. That tells me that there's definitely there's some trigger points there. Okay, so I want to spend, I could take my fist and just move in, and you can use your fist too. And what's really cool is that you can teach this to your children, you can teach this to your husband or your wife. It's a great technique to do with each other. What I really love about this technique, not just the health benefits, but the emotional benefits. It really helps with calming the nervous system down, the central nervous system down. And when your central nervous system is calmer, you feel more balanced. And when you feel more balanced, you can make better decisions, you have better clarity, you have more awareness. And what a wonderful gift to give to someone that you love. Okay, so now we've done the pelvic floor, we've done the small intestines, and now we're going to go to the large intestines. And so the large intestines, we have the ascending colon, the transverse colon, and the descending colon. The descending colon is on the left side of the body, and it runs from the bottom of the ribs down to about, a little bit past the top of the hip bone. So I recommend to take your fist. If you can't use your fist, again, use the pads of your fingers, and you want to clear the pathway. And this is how you clear the pathway. You just move in a downward motion, and again, as deep as you can. The deeper the better. But again, you don't want to hurt yourself either. But if you feel a little bit uncomfortable, that's okay. All right, and this actually feels really good on this person. I don't feel any trigger points or any tension. And so you just want to do that 3 times. And now I'm going to clear the transverse. So if you can see, I'm sure you can. I'm right in the middle of the bottom of their ribs. And I'm going to move across the body to the other side of the rib. So I'm going to move from the right side, bottom of rib, to the left side, bottom of rib. And I'm going to do this 3 times. So now I'm going to clear the ascending colon, and I'm going to start at the top of the right hip, and then I'm going to move towards the bottom of the right rib. Now I definitely feel more tension in the ascending colon. So I'm going to do this 3 times. And again, going as deep as you can. Now, because I feel more tension on this side, I'm going to spend more time like I did with the small intestines in certain areas, just to help release this tension. Now, the benefit that I hear from most of my clients is I poop better. I poop more. I feel less bloated. Diet is also key too, right? There's not one magical pill to take care of everything. So being hydrated, eating good food, clean food, lots of veggies, fruits, and good protein is also important. And some nuts and seeds. Okay, so now what I want to do is go from the bottom of the ascending colon and come all the way up and come across the transverse and go down the ascending. Down the descending. My bad. So I'm going to do that again. Come up the ascending, come across the transverse, and down the descending. And I'm going to do that one more time. Come up, come across, and come down. Okay. So now this whole section, the abdominal section, feels nice and loose. There's still some tension, but it's less tension. And when you do it consistently, you'll find that everything feels nice and smooth. So now if you go out to eat and you have a couple of drinks and you're eating foods that aren't necessarily the best foods, and your stomach feels, oh, this is a great time to do this technique. It will help settle it out. Okay. So now let's go to the last section, which is the thoracic cavity. And what we're looking to accomplish is to release the diaphragm. Some of us will breathe short breaths, and others will breathe long breaths, and others will have a tremendous amount of stress going on in their life. And this can create a lot of tension in the diaphragm. And when you have any tension, whether it's in the diaphragm or in the abdominal area, the pelvic floor, it's going to create a tremendous amount of downward pressure. And all that downward pressure, this is really important for women, all that downward pressure can create a pelvic organ prolapse. And so it's not only going to, this technique is not only going to help with all the things that I shared with you, but it's also going to help with protecting this pelvic floor. So how do you work with the thoracic? It's really easy. All you want to do is take your thumbs, or any way that you feel comfortable that you can get up underneath, and work the diaphragm. Now, their diaphragm is really loose. You can see how nicely I can get up underneath these ribs. Now, you're not going to hurt your diaphragm. Now, most people's diaphragms are really, really tight. I mean, I can only go in this far. But with this person, I can go really deep. And I can actually manipulate their ribs, which is nice. And this is what you want to do. You just want to get your fingers up underneath as far as you can go and as far as it's comfortable, and just manipulate. All right? And gently do it. You won't break your ribs. Then what you want to do is take your thumb or your fingers, and you're going to move downward towards the outside of your body, underneath that rib, to help release the diaphragm. Do you see what I'm doing? Yeah? And again, if you have questions or concerns or don't quite understand something, just email me at madison@coachmlb.com. So I'm putting my thumb right under that rib, the bottom part of the rib, and moving in a downward motion to help release the diaphragm. You always want to spend more time in the areas that have more tension or trigger points, but remember, you must do the entire technique for this to work. You have to do the pelvic floor, the abdominals, and the thoracic. They all work together. So we're going to go to the left side and do the same thing. You're going to go in a downward motion, trying to loosen up that diaphragm. Now this side, on their left side, it's a little bit tighter right in here. So I'm going to spend a little bit more time loosening up this diaphragm. But I still can get under there pretty good. So it usually takes about, I don't know, 5 or 6 times to really move the tension or the trigger point. But it may take longer. Everyone's different. And then I want to get my pads of my fingers up underneath that rib, the bottom ribs, and try to move your ribs a little bit. Now, this person's ribs are moving really easy. Most people's ribs do not move this easy. So don't be surprised if you get very little movement. Over time, you're going to get a lot more movement if you're consistent. Okay, so I'm going to go in a downward motion a few more times. Okay, and then what I like to do is just do a laying of hands and breathe in through my nose to the count of 4, and then breathe out through my mouth for the count of 4, and do that 3 times, and then voila, you're done. So before you begin this technique, you want to make sure that you do not have a diastasis recti, which is also known as a DR. And a diastasis recti is a separation of the linea alba. And the linea alba runs from the bottom of the sternum to the top of the pubis bone. And this is really what holds your abdominals together. And sometimes it can separate from having too much pressure from pregnancy, constipation, weightlifting, excessive stress, poor posture. So if you do have a diastasis recti, there's a different technique that you would need to do.